Bismillahirrahmanirrahim. With faith, discipline, and selfless devotion to duty, there is nothing worthwhile that you cannot achieve. Muhammad Ali Jinnah. Today, my topic of presentation is how to critically appraise a paper, an example by under the supervision of Professor Dr. Saira Afzal. Learning outlines. In this presentation, I will discuss a brief introduction to a critical appraisal, how to critically address an article, the introduction, the ethical issues, study designs and results, how to identify and avoid bias in research, what is the critical appraisal checklist for a qualitative research, and how to critically appraise a quantitative research, and further examples will be discussed. At the end of the presentation, the participants will be able to describe the key points of critical appraisal and how to handle different types of bias in a research article. So in my last presentation, I explained each and every portion and the questions to be asked in every section of the research paper. Here is a brief introduction, a brief overview of the questions that need to be addressed while critically appraising a paper. We start with a broad question, and then we come to our focused research question, and we explain what is the research question and what is the study ethical issues, what is the study design, what are the results, and what are the implications of the findings of the clinical practice. Now, here is an example of a paper. The title of this article is Mortality After Fluid Bolus in African Children with Severe Infections. Under the title are given the names of the authors, and a little background is given that the role of the fluid resuscitation in the treatment of children with shock and life-threatening infections who live in resource limit setting is not established, and this is the background that the paper will start. Now I will come to the next portion of the research question. As I have already told that there are 5 to 6 questions that need to be addressed. The first question is, what is the scientific rationale? So here the role of the fluid resuscitation in the treatment of children with shock and life-threatening infections who live in resource-limited setting is not established. So although the approach is endorsed by pediatric life support training, evidence regarding the criteria for intervention and the volume type of fluid is lacking. The purpose of reading the whole paragraph is that whenever a rationale is given, you can either comment yes, the rationale is given, or you can either write a simple paragraph and explain and show it to the viewers that the rationale is given. If a hypothesis is given, like in this case, just mention it like rapid early fluid resuscitation will lead to improvements in outcome of children with shock. So hypothesis was mentioned in the study. The study was conducted in Kenya, Tanzania, and Uganda. Children were aged 60 days to 12 years with shock. That was the study population. Interventions were compared, which included albumin bolus, saline bolus, and no bolus. That were the controls. So 3 groups were there. What outcomes were considered? 48 hours mortality, pulmonary edema, increased intracranial pressure, mortality, neurological sequel at 4 weeks. So these are the 6 questions you need to address regarding the study question or the research question. Next, the ethical issues. In terms of ethical issues, all patients should give informed consent prior to participating in any RCT, and knowledge of what treatment the patient is to receive should not have any impact on whether she or he is recruited into the trial. So in this trial, first question regarding the ethical issues was there a real need to conduct the trial? Was there a balance of interest when the trial was initiated? Apparently so. This was present in the study. Was the study approved by an ethical committee? There were approvals from the ethical committees of Imperial College, from the Macquarie University, Uganda, Medical Research Institute, Canada, and National Medical Research Institute, Tanzania. Here, a reviewer must mention from where the ethical approval has been taken. And regarding the informed consent, the prior written consent could not be obtained in this case. So, provision of oral assent and the late consent at the time of the trial, delayed written informed consent was options were given. And the last question is, was the trial of sufficient size to reach a meaningful conclusion? Here, the point to focus is whether the sample size was sufficient and what type of and how the sample was included, how the study population was handled. So in this case, a total of 3,600 children were included. Power of the study has been was set at 80%. Two-sided alpha level, 0.05 level was a level of significance was adjusted, and this is all mentioned in the paper. So you just have to focus on different parts and take out the important points and adjust in the following questions. Now, regarding study design, it was a multi-center parallel randomized control trial. The treatments that were being studied was 0.9% saline bolus, 5% human albumin bolus, and no bolus. And the participants that were included in the trial were children between 60 days to 12 years of age, presented with febrile illnesses complicated by impaired consciousness, respiratory distress, or both. Next question is, was randomization performed? This is important, and it is important to comment on whether the randomization was done, whether blinding was done, whether the randomization was achieved, and whether the groups were equally divided, what the treatments were given. These are the important points while addressing a randomized control trial. So in this case, the randomization was done, and the blinding was done, and the treatment of the when were the individuals in the different treatment equally? Yes, they were treated equally. So there is a comment that it appears so. Now, regarding the results, how many patients were included in the trial and compared to the size? Did randomization work, and did any patient drop out of the trial? And if so, did dropout rates differ by treatment arms, and what analytical approach was used to allow the loss to follow up and treatment switches? So, in this paper, the authors have given this patient's flow sheet to show the equal distribution and balanced distribution between the controls and the experimental group. In terms of randomization, the randomization was the two groups were broadly classified. They were similar at the start of the trial, uh, and existing the statistical methods used were sufficient, but if biases are induced, then we can also use multivariable methods, and it is not appropriate to formally test whether differences are significant or not, assuming study isn't fraudulent. Any differences must be due to chance, and this approach is likely to lead to high type 1 error rate. In this study, the authors have mentioned the endpoints of the trial and what were the main results of the secondary endpoints. Now, I will give a brief explanation of the endpoints. Generally, in a randomized control trial, there is a primary endpoint that is usually related to the efficacy related, but sometimes there are secondary endpoints as well that are related to efficacy or safety of the drug. So major decisions based on the results from the primary endpoints and are made from the primary endpoints. The secondary endpoints only add the supportive data. For the endpoints, they should be defined before in advance, and they should cover most important aspects of disease progression and be clinically relevant to the population that is included in the trial. Uh, so in this case, Um, um, the estimation of the treatment effect was done. Additional benefits provided by the new drugs over and above, which would have occurred using the standard care or by chance in the placebo controlled trial. The authors estimated the treatment effect via absolute risk reduction, relative risk, odds ratio, and number needed to treat. I have not given the details of each and every calculation because the presentation would have been very lengthy. So, only comment on the points or on the methods used for estimation of the treatment effect. Generalizability of the population and setting and intervention, it is important. Comment on it. Consideration of all important outcomes, that is efficacy, safety, acceptability of the treatment, and cost and benefits should be mentioned at the end. So in the summary, to maximize the benefits of the trial design, important that RCTs are designed and analyzed appropriately. Treatment effects, confidence intervals should be provided, as well as some discussion of clinical impacts. And particular care should be taken when interpreting RCTs that include many endpoints and that involve large numbers of subgroups, so post-hoc analysis would be needed. Here I end this example and I will further explain the critical appraisal with more examples, but here I would like to touch how to identify and avoid bias in a research. So the major source of bias in a clinical research is before the trial. In case of a randomized control trial, I'm continuing the same example of randomized control trial. But you can apply these biases to other study designs as well. Trial planning, during trial implementation, and during data analysis and publication. First of all, during pre-trial biases. Uh, Here, I would first explain the selection bias, how to avoid the selection bias. Select patient using a rigorous criteria to avoid confounding results. Patients should originate from the same general population. Well-designed prospective studies help to avoid selection bias as outcome is unknown at the time of enrollment. So it is important to that patients are there is a rigorous criterion. Patients should originate from the same general population that is under study. For the flawed study design, clearly define risks, outcomes, preferably with objective or validated methods. And standardization and blinding can also eliminate this bias. Channeling bias, assign patients to study cohorts using rigorous criteria. So, tips to avoid different types of bias during a trial. For an interviewer's bias, standardize interviewer's interaction with patients, and blind interviewer to exposure status can eliminate bias. For recall bias, use objective data source whenever possible. When using subjective data source, corroborate with medical records and conduct a prospective studies because outcome is unknown at the time of the patient enrollment. For transfer bias, carefully design plan for loss to follow-up of patients prior to study. Exposure misclassification, clearly defined exposure prior to the study and avoid using proxies of exposure. Outcome misclassification, use objective diagnostic studies and validated measures at primary outcomes. And for performance bias, consider cluster stratification to minimize variability in surgical techniques. Now for the biases after the trials, the citation bias. Registral trial with an accepted clinical trial strategy, check registers for similar unpublished or in progress trials prior to the publication. And last is the confounding. For the known confounders can be controlled with the study design like case control line or randomization, or during data analysis via regression. And for unknown confounders can only be controlled with randomization. So this is important. Internal validity and external validity is also important in terms of while critically appraising an article. So internal validity reflects the study design, implementation, and data analysis have minimized the bias and the findings are representative of the true associations. While external validity deals with degree to which findings are able to be generalized to the other groups of populations. Usually, the internal validity trials are conducted. The trials that are conducted under idealized conditions have high internal validities, and such high-level studies can evaluate using a jaded scoring system and establish rigorous meaning of assessing the methodological quality and internal validity of clinical trials. While the trials having a high external validity, they have a loose inclusion criteria and may compromise the study's internal validity. The difference is that the difference between the source population and the study population should be clearly distinguished if you have to have an external validity, good external validity, and also to distinguish limited ability to be generalized due to the selective patients from the bias. It is also important. Now the conclusion that bias can occur in planning, data collection, analysis, and publication phase of the research. Understanding research bias allows readers to critically and independently review the scientific literature and avoid treatments which are suboptimal and potentially harmful. A thorough understanding of bias, how it affects study results, is essential for practice of evidence-based medicine. Now, the critical appraisal checklist for an article if you are doing a qualitative study. This is a generic checklist that has been taken from the critically appraising skill program, and the link is given on the in the footnote, and you can download it anytime you want. Here is the checklist. The main questions to be addressed is the paper worth reading? Are the results credible? And what are the results? And there are sub questions under each heading for and you can answer it yes, can't tell, and no, and then you can critically appraise the whole article. Like, I will just explain the first section. In this paper worth reading, did the article describe an important clinical problem addressed by a clearly formulated question? You can either take yes, can't tell, no. Was a qualitative approach appropriate? And then you can go to further, like considering the methodologies, the sampling size, what is clearly why sample participants choose not to take part. So these points you can address, and you can take, and you can appraise the article. Here is the second page. What methods did the researcher use? You have to take each or every one. The things that are present, you have to take yes. What are the results? Then you can come and critically appraise it. In terms of when you are doing quantitative research, the form is taken from this form is used, and this has been taken from Macastre University. Here is the form, and this is the first example. So it starts with the citation. Either you can do it in the AP or Vancouver. This is in the Vancouver style. Now the study purpose. The question that needs to be addressed is outline the purpose of the study and how does it apply to your research question. Here in the left box, first of all, you have to state the answer. Was the study purpose stated clearly, either yes or no? If the purpose or the rationale has been given, so you have to take yes and state the purpose. The study is merely a review paper which aims at determining the frequency of surgical complications. After, you have to give only a brief description of the purpose of the study. Now coming to the literature review. Was the relevant background literature reviewed? Either it is reviewed or not reviewed. You have to give yes or no. So describe the justification for need of the study. This is the rationale of the study, or the main objectives. You can cover the main objectives, or you can comment on the background. The review of literature is good and comprehensive. This single line is also enough to comment, but here I have added some lines to just show that if you want to add some lines, then you can briefly add a small background that the main highlights in the article are related to different, and so on. Now coming to the study design, sorry. Here the study design. I have not taken any of the study designs because the option was not present here. This is a retrospective review on the subjective renal complications, and no study design is mentioned. So you have to mention whether a study design is mentioned or not. And next you have to Also specify the biases. Here in this paper there was a researcher bias and information bias. Only write, mention the biases. For the results, the first question that need to be answered is results were reported in terms of statistical significance. Means whether the level of significance was given, or the results were explained in terms of that 0.05 level is statistically significant and this and that. If it is given, then say yes. And if it's not explained, then only explain the results of the study in a single line, like results of the study were described in terms of frequency percentages, but the results were not explained in terms of statistical significance. And appropriate method, so I have commented that it was a simple review with descriptive sensitivities and this method of analysis was appropriate. Clinical importance, yes, it was mentioned. Dropouts, there were not dropouts, so I have given not addressed. Conclusions and implications, there were the conclusion was given. You can also hear if any implication or any bias or limitations were mentioned. In this case, no limitations were given, so I have not commented on that part. So in the second example, here is the citation. Yes, the study purpose was clearly stated, and the study purpose is this: to um, compare the effect of rifampicin with neomycin in chronic liver disease. Yes, relevant background literature was reviewed. The literature review is relevant and easy enough to understand with various aspects of hepatic encephalopathy. Here I have not given the paragraph to explain the background, just a simple line. Design, that was a randomized control trial, so I have given randomized control trial. Study design was randomized and study design was appropriate and relevant to the study objectives. The biases were selection and confounding. Sample. Yes, sample size was described in detail. Yes, sample size was justified. And here I have mentioned a brief explanation of the sample, how many patients were included and what was the sampling technique. Ethic, yes, informed consent was taken. So I have ticked yes. In terms of outcomes, the main outcome was this ammonia and the list of quantitative variables and qualitative. It is better to mention qualitative and quantitative variables separately. So in terms of this, quantitative variable ABM post-op ammonia levels and qualitative was gender. Intervention, that the intervention was clearly stated and described in detail. Yes, I have ticked it, intervention. In terms of results, yes, the results were reported in terms of statistical significance. Here I have mentioned it. An appropriate comparative analysis was done between two groups for males and females, and yes, the appropriate method was appropriate. No separate clinical importance was reported, no dropouts were reported, and in conclusion, a significant decrease in baseline ammonia level was reported, and these were the bias. But sometimes there is an there is a compulsion to write a small review. So in this case, you can write a small paragraph or a small report after critically reviewing an article. So if you have to write it in terms of a paragraph, you can write this report. I have written it for a systematic review. First, you have to report the status, whether it is approved, advised, revision, or rejected. Then you can add a small paragraph of the summary. Like for this systematic review, the objectives on page number 2 is not well constructed and need improvement to follow the correct SMART criteria. Abstracts need to be revised and more focused on current work and results obtained. Prisma guidelines and flowcharts was not followed. Aims and objectives are in not line with the result and discussion. The results are mentioned without any statistical analysis. The manuscript is written without understanding of study designs. Rationale need improvement. The method is based on 2 months survey from January to March only. This indicates a concern in terms of longer span and thus the results obtained may deviate over a larger period. It is more beneficial to conduct a survey on at least several years. Here I have just tentatively given 2 years. The manuscript is to be improved for grammatical errors and sentences language needs to be corrected and revised accordingly. Here I write the date, the name, date and the signature. So this is the way you can also write it in a small paragraph. Here I end my presentation and now it comes to the MCQs. My first MCQ is that some disciplines require the use of information that is as current as possible. And this particularly true in disciplines of medicine and science. While conducting becomes absolutely very quick as new discoveries are made. Hence, a literature review is best described as a list of relevant articles and other published materials you have read about your topic, an internet search of articles describing relevant research on your topic, criticizing the methodology and reliable findings, and evaluate overview of what is known based on published research, theoretical counts, and what the future research, and the last is an essay looking at the theoretical background to your research study. So what would be the answer? The answer is C, an evaluative overview of what is known, what is published, and how can it help in future policy decision. While doing research, which is the most reliable source of information for your literature review? A TV documentary, a newspaper article, a peer-reviewed research article, a relevant chapter from textbook?
C.
Yes, a peer-reviewed research article is most reliable source of information in terms of literature review. Here is a paper about the systematic approach to a successful literature review by Diana Taylor. She describes literature review simply as a summary of key sources. So the starting point for every literature search is a primary data, a secondary data, tertiary data, or some other data. The answer is tertiary data because I will explain these data. Tertiary data is the data that is the books, the journals, the available information on internet. The secondary data includes the census, the data that is collected under any other research under government, and the primary data is the data that is taken by the researcher, him or herself. So the literature view starts with the tertiary data. So the answer is C. While reviewing an article, you see that authors of the article have cited, author of the article, that is author number 1, has cited another author, that is number 2. In this scenario, it's good practice to use the work and attribute it to author 2, not to use the work. Use the work and attribute to author 1, or locate and read the original article and then attribute to author 2. What is the right answer?
A.
No. A could be the answer, but it is better to locate and read the original article first and then attribute it to author 2. This is a good practice. So which is the major disadvantage of using a peer-reviewed journal in literature reviews? Subscription fees are high. Information could be as old as 4 years. Human controls the quality. The information is too recent.
B.
Yes, the correct answer is B because the major disadvantage of using the peer-reviewed journals is that the information could be old and you can add the old journals or articles from the journals as they're peer-reviewed and are authentic and you are relevant to your subject. So number 6, appraisal of literature reviews on the end life of care of minority of ethnic groups was published by Natalia and Aranza in 2000 to review and evaluate the minority ethnic groups. The goal of this critical appraisal was to, here you have to remember the steps for the critical appraisal, the basic purpose of critical appraisal, whether to determine where the faults exist in the study design, evaluate whether a proposed study is feasible, identify meaning, credibility of the study, review the credentials and expertise of the researcher. So why we critically appraise an article? The answer is C, is to identify meaning, credibility, the strengths, limitations, and the suitability of the study. That is the main purpose of the critical appraisal. So the answer is C. When critically appraising a research study, the reviewer will expect to find identification of new research problems, implementation of perfect study designs, precise understanding of or tool to control outcomes in medical practice.
A,
Yes, the answer is A. The purpose of critically appraising a research study is to identify a new research problems, because there is no study design that is perfect and no tool or any outcome that can be perfectly measured, and precision of the understanding of the real world is not possible. So critically appraising means identifying a new research problem. Before starting research, one should define the time frame for his and why a time frame is set, so that you can find the you cannot find the library, don't find the library busy, so you don't incur unnecessary cost, so you don't find the most articles, so you work when you're most efficient. And the answer is D. But the purpose of setting a time frame is that you work at the you set a time frame, you work most efficient during that time period. So the option is D. Mike is a first-time researcher who is working on a group of 100 people suffering from type 2 diabetes mellitus. Because the number of things that could go wrong in this research, there is a need for Mike. That is flexibility, perseverance, sympathetic supervisors, an emergent source of finance, and wisdom to know the right time to quit. The answer is A. Because flexibility and perseverance are most important traits that a researcher or a first-time researcher might have, because there are many turning points in research, and sometimes you have to change the research many times. So flexibility and perseverance is the answer. Last MCQ is that the results of an article by Loraz and Maria shows that the standardized age prevalence hypertension at baseline is 74% for men and 70% for women. And there is a decrease in diastolic systolic pressure after follow-ups. These results can be utilized in evidence-based practice, and how can be used. Only evidence and data from strong studies are used. Only quantitative studies are used to build evidence. Strong points from multiple studies are used, and studies must be replicated successfully to be used for evidence. How these study results are utilized to develop evidence for practice.
A,
Uh, no. Uh, Only the evidence and data from the strong studies cannot be used. The important is that the results must be replicated. There must be a repeatability. There must be a reliability of the results. So D is the option. Whenever you have to develop an evidence, so for it's necessary that the results are replicable and there is and are reliable. So D is the option. Here is the key, and thank you.
Thank you very much. Number.
Yes, ma'am.
Right, Dr. Amber, we
Uh,
may leave the meeting.
okay, ma'am.